Next, we have Senator McGuire. Senator McGuire is presenting on SB 987. Is that correct, Senator?
Yes, sir.
Please proceed.
Thank you very much, Mr. Chair. Good morning, Mr. Chair and committee. I want to say how much I appreciate all your efforts on this complicated and critical issue over the last year. The chairman has done a fantastic job and could not have gotten this far without you, sir. Truly, thank you. And look forward to working with all of you in this committee on SB 987. As we stated last year, once the necessary regulation was put into place, which happened thanks to the legislature and the governor, we would need to be able to follow up with a marijuana user fee and invest the proceeds to make our state and our local communities stronger, safer, and to be able to protect our environment. And this is what this bill is all about. In very simple terms, the legislation implements a 15% point-of-sale fee on all medical marijuana products, including edibles, tinctures, salves, and vapes. The 15% will raise between $100 and $250 million per year, depending on how long it takes dispensaries who are not already within the BOE system to become licensed under the newly developed program. The bill dispenses the money in the following ways. 30% of all revenues from the funds will go to the Bureau of Medical Marijuana Regulation to distribute via grant programs designed specifically for local agencies that oversee or are affected by the cultivation and sale of marijuana. This bill would include all local law enforcement in every city, county in the state. All fire departments would be eligible, all zoning enforcement agencies. Funds would be available to any city or county department or agency. 20% of all revenue will go directly to all county human service departments for drug and alcohol treatment, along with recovery and case management services on a per population basis. And we do know in every county in this state there is significant need for revenue when it comes to drug and alcohol treatment programs. 20% of the revenue will go directly to the Department of Parks and Recreation for the operation of state parks. Nearly every park in the state have been impacted by rogue marijuana grows. And 30% of all revenues will go directly to the state general fund. If acceptable to your committee, we will work with your staff on several amendments suggested by the Governance and Finance Committee, including by Senator Bell, including changing the name to the Marijuana User Fee Act. This really is a user fee, and we agree with the committee that the changes are warranted. We've also begun working with your committee and the Board of Equalization to find a fair and equitable way to exempt the neediest patients in our state. And I do want to say thank you to the Senator for bringing that forward in the previous committee. In addition, we're working on language suggested in your committee analysis to make sure that this program is fully funded from the outset via a loan from the general fund that will be paid back with the first receipts of the user fee. Now, this mimics the successful model that has now been implemented with the marijuana regulation legislation that was passed last year. And those positions that are funded in this year's budget will be refunded via the license program that is now being implemented across the state. You may hear from some good folks that believe a 15% user fee is too high, and suggestions that we collect it higher in the supply chain, such as at the cultivation or at the distribution points. Both Washington and Colorado started with high fees and complicated formulas for taxation at the high end of the supply chain, for example, at the cultivation side or at the distribution side. And after a lot of tough lessons, both migrated to a lower fee, similar to ours, into the much simpler point-of-sale fee. This is what works across the nation, just like we propose in this legislation. Sometimes it is good to be number 3, sir. And we already have language that ensures that there will be no double taxation with this bill. If the Parker initiative passes this November, the user fee will not be implemented. And finally, there are some cities and counties that want to pass their own taxes on medical marijuana, or who have already done so, and we strongly support them. In fact, it was due to the great work of your chairman last year that we made certain that cities and counties maintain the right to bring forward a local tax wherever they could. But let's be honest, not every county or city are like those that are in Marin County. And there are those communities that are significantly disadvantaged who also need the assistance from this user fee. For decades, taxpayers have had to bear the high costs of public safety to deal with the black market and criminal element of the industry. This user fee will give law enforcement and other agencies billions of dollars over the next decade that would otherwise have to continue to come from taxpayers. In addition, Mr. Chair, our general fund has had to cover the immense cost to the judicial as well as human services and other function over the last few decades. The user fee is designed to help address these issues in a fair and conscientious way, and would respectfully ask for an aye vote and to be able to come off suspension at the appropriate time.
Thank you. Witnesses in support? Witnesses in support? Witnesses in opposition?
Good morning, Chairman. Good morning. My name is Don Duncan. I'm with the California Director of Americans for Safe Access, and just wanted to briefly reiterate what I said previously on the bill. 15% is a very high tax, and this is a tax on consumption for individual patients who are legal, legitimate medical cannabis users under our state law. And so we are asking for a delay in the policy of taxation. Unlike Colorado and Washington, this tax is on medical cannabis and not on adult use cannabis. And so this is a fundamentally different issue that impacts legal patients in our state. This tax will be on top of sales tax, it'll be on top of local taxation, and it'll be in addition to any other taxes or fees imposed by the state legislature. And so we're very worried about the excessive burden on legal medical cannabis patients, and that this may incentivize them to go back to the illicit market, which is exactly the opposite of what the authors of the MMRSA sought to achieve by passing that historic bill. And so we want to make sure that this marketplace functions properly, and we don't push patients back out of that legal space that we've made for them. I also want to point out that it may be procedurally easier to pass a high tax and lower it later, but it may not be politically easier to do that. And so I want to urge extreme caution in stacking on taxes right now so that we don't get in a situation where revenue streams are opened and they're very hard to close up later. Thank you.
Thank you. Additional witnesses.
Thank you, Chair. Members, Hezekiah Allen on behalf of the California Growers Association want to start by identifying common ground. We need this fee. We need to put corrective monies back into dealing with the problems that have been externalized by the supply chain. That said, I have to agree with my colleague from Americans for Safe Access. This fee is simply too high to start with. We need to start low and go higher in order to move businesses into the supply chain. Last comment, unlike Colorado and Washington, California is much larger. They are not good comparative models. We have a very, very different supply chain and industry. We have a single city that you represent, sir, in part, that is larger than both of these states' marketplaces combined. To use those as models is inappropriate in our opinion. We can do better, and we need to lead on this issue. Respectfully urge you to vote no on this bill today.
Thank you.
Melanie Cuevas on behalf of California Cannabis Operators League, also in opposition for the reasons previously stated.
Thank you. Finance.
No file.
No file. Comments or questions from committee? Senator Bell.
As the bill evolves, I think it's very important that in terms of taxation, the voters approves an initiative on defining the medical elements of marijuana, and in the fact that medicine is not taxed. So I think that issue needs to be resolved in the bill, and as it continues to evolve, I think that we have to be aware when we tax medicine that's a limit on access to health care, and so we have to respond to that in some way. And I hope that a solution is forthcoming in the drafts that you are working on, and I'll be happy to work with you on that, because I think denial of access is a principle we don't want to establish in the law.
I agree.
Thank you. Additional comments or questions from committee? Seeing and hearing none, Senator McGuire, would you like to close?
Thank you so much. And do want to address the issue. We are working on a solution and already have some preliminary language that will be working with the chairman and committee on, and I do believe it will be of great assistance. And I think the important piece, and I'll just end it with this, Mr. Chair, is that for 20 years, medicinal marijuana has been legal in California. And what we know is that there have also been significant impacts in our communities based off of this multi-billion-dollar industry. And while the vast majority of individuals are following the law, there is also a rogue element, which has cost our communities in our state billions of dollars in environmental damage and in issues regarding public safety. And I think the other important piece is the way 215 is structured. It forces all legal users into the medical marijuana system. And some say that 100% is all going to medical marijuana, and what we know is it's much less than 100%, and some say it's around 30 or less. So we are more than willing to be able to continue to work with this chair, and I do want to say thank you to the chairman for all of his work, and Senator Bell, I promise you we are working hard on that issue.
Thank you. Without objection, we move this item to suspense.
Thank you.
Thank you. Senator Bates, would you like to present your item? Senator Bates will be presenting on SB 1323.
My witness may sit there.
You can do whatever you want, Senator. You're the vice chairwoman of this office.
Good morning, Mr. Chair and members. Senate Bill 1323 adds fentanyl to a list of dangerous drugs, including heroin and cocaine, which are subject to sentencing enhancements based on weight. It is sponsored by the Orange County Sheriff's Department. It is up to 50 times more potent than pharmaceutical-grade heroin and is often mixed into heroin and other drugs without the knowledge of users. This drug is also cheaper to make and easier to transport than heroin. These factors combine to make fentanyl the emerging go-to drug for cartels. It's important to note that it can be deadly simply if it becomes airborne or makes contact with the skin, posing significant danger to first responders. Because SB 1323 only goes after the top echelon of drug dealers and distributors, the cost of implementing this important bill would be minimal. In fact, the sponsor of the bill has only been able to point to one case that rose to the threshold of an enhancement under this bill. While the cost is low, the impact cannot be understated. Just 1 kilogram, this bill's threshold amount contains between 500,000 and 4 million lethal doses of fentanyl. CDCR could incur costs between $15,000 and $750,000 due to the anticipated rarity of the cases meeting the required threshold. However, it's most likely that state costs would be at or very near the low end of that range. This is a small cost to prevent drug cartels from poisoning and killing Californians. As you know, 11 Sacramento residents have died from fentanyl overdoses in the past few weeks. The bill in no way impacts sentences for end users, those using medical fentanyl for its legitimate and prescribed purpose. Joining me today on behalf of Orange County Sheriff's Department is Captain Stu Greenberg from the Investigation Divisions. Captain Greenberg.
Witnesses in support.
Good morning, Mr. Chair, committee members. Thank you for allowing me to testify. As the Senator stated, the opioid epidemic sweeping the country right now is a national health crisis. The resurgence of fentanyl across the country has become a huge concern because of its potency. It's much more powerful than heroin, 50 times or more, as the Senator said, much more dangerous. It can be inhaled or absorbed through the skin, and it's killing people. It's killing people every day. Just recently, within the last few weeks, Sacramento saw a string, I think, of 10 people die from fentanyl overdose. This bill does not target the end user, does not target small-time dealers. As the Senator said, a kilo has roughly about 4 million lethal doses, potentially lethal doses. As far as impact to the state prison system and cost, I've reached out through the entire county of Orange County, which is over 3 million people, and in the last couple of years, we had one case that would have rose to this level. The subject in question there was deceased, so that did not happen. I also reached out through the National HIDTA program, which is the High Intensity Drug Trafficking Area Program, maintained by the United States Office of National Drug Control Policy, through the entire Southern California region. That include the DEA, FBI, and major organizations like LAPD and Los Angeles County Sheriff's Office. The number of cases we saw in the last couple of years in talking to all of these agencies was in single digits. So we're not talking about a significant impact to the state prison population at all, but we are talking about putting these enhancements in line with heroin and cocaine. And again, fentanyl is much more dangerous than heroin and cocaine. Also, as I mentioned, fentanyl is a lot less expensive. A kilo of fentanyl, roughly, because it's a new trend, is about $2,000 to $7,000. A kilo of brown heroin can go $30,000 to $35,000. So we're looking to try to get in front of this. The East Coast is already completely saturated with this problem, and I can tell you across the country, people are looking to see what we do with this.
Thank you.
Thank you.
Next witness.
John Lovell, on behalf of the Association for Los Angeles Deputy Sheriffs, the Association of Deputy District Attorneys, California Association of Code Enforcement Officers, California College and University Police Chiefs Association, California Narcotic Officers Association, Los Angeles County Professional Peace Officers Association, LA Police Protective League, Riverside Sheriffs Association. They're in support, and if I could be permitted a quick historical reference, the original punishment by the pound law, to which this 1323 will now add fentanyl, was the very first bill I got passed as a lobbyist in 1985, and Senator Nielsen was in the Senate at the time, and he was one of my first votes for that bill.
There you go. Additional witnesses in support.
Nicole Wortelman on behalf of the Orange County Board of Supervisors in support. They feel it's a low cost for numerous lives saved.
Thank you. Question, finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, Senator Bates, would you like to close?
Just as I know it's on its way to suspense, but consider the impacts that this is having on our population, our young people, actually the age range 18 to 59 who suffered severe damage and death, a number of them with this drug. So that cost is immeasurable in terms of what it would cost to ensure that the people at the head of this whole ring are incarcerated for lengthy periods of time. And that has been effective in prior years in stopping at least the import. Getting to the addiction is a whole other issue that we have to address. But I ask for your aye vote when we look at that suspense file.
Yes, which you and I will be looking at.
Yeah.
Senator Bates, without objection, we move this item to a suspense file.
Thank you.
Thank you. Members, that concludes the presentations for today. We're going to move down the agenda to give potential witnesses an opportunity to support or be against any of the measures. We're going to begin with Senator Roth's items, beginning with SB 870. Witnesses in support, witnesses in opposition, finance.
No file.
No file. Without members, any comments or comments or questions from committee? Seeing none, without objection, we move this item to a suspense file. Moving on to SB 883, Senator Roth. Witnesses in support, witnesses in opposition, finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to a suspense file. Moving on to Senator Bell's item, SB 873. Witnesses in support.
David Jones on behalf of the City of Glendale in support.
Thank you. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to a suspense file. Moving on to SB 908, Senator Hernandez. Witnesses in support.
Autumn Ogden on behalf of the American Cancer Society Cancer Action Network in support.
Thank you. Additional witnesses.
Lovell on behalf of the Los Angeles County Professional Peace Officers Association in support.
Thank you.
Michael Young on behalf of the California Labor Federation in support.
Thank you. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 9, Senator Pan's items, SB 947. Senator Pan, witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Pan's SB 1058. Witnesses in support.
John Lovell, California Correctional Supervisors Organization is sponsor, and the other law enforcement organizations who I previously enumerated, all in support.
Thank you. Witnesses in opposition. Finance.
Department of Finance is opposed to this legislation. We believe that it supersedes CalHR's statutory authority to have the discretion to set compensation levels and benefits for excluded employees, and result in unknown but potentially significant statewide employee compensation costs. The administration is currently in negotiations with CSLEA, like today, whose MOU expires in July. Since this legislation requires the administration to meet and confer with the excluded employee organization to determine the benefits provided under the bill, we don't know exactly what could result, but as a point of reference, the cost to provide CSLEA excluded employees with a 1% salary increase is estimated to be $1.7 million, $500,000 of which is general fund. We also have some concerns with implementation of the bill as it's written.
Thank you. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 953 by yours truly. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to Senator Vidak's item, SB 967. Witnesses in support.
Ed Behrens, on behalf of the Los Angeles County Board of Supervisors, in support of the bill.
Thank you. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 986 by Senator Hill. Witnesses in support. Witnesses in opposition. Finance.
Department of Finance is opposed to this bill. We don't think that the fine is unreasonable.
Witnesses, comments or questions from committee? Seeing and hearing none. Without objection, we move this item to a suspense file. Moving on to Senator McGuire's bill, SB 1169. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1023, Senator Jackson. Witnesses in support. Witnesses in opposition. Finance.
We're opposed to this bill. We think it would result in significant general fund costs not included in the administration's current fiscal plan. The governor vetoed an identical bill last year, specifically saying that he'll be working with the Judicial Council to develop a more system-wide approach to balance the workload for the courts.
Thank you. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to Senator Leno's items, SB 1053. Witnesses in support.
Ed Behrens, on behalf of the Los Angeles County Board of Supervisors, in support of the bill.
Mr. Chair and members, Tracy Stevens on behalf of the Jewish Public Affairs Committee. Thank you.
Witnesses in opposition.
Mr. Chair and members, Steve Carlson for the Apartment Association of Greater Los Angeles and the Santa Barbara Rental Property Association. We oppose the bill. In effect, mandates small property owners to contract with the federal government to engage in a program that is broken in many instances. We just do not think it's necessary. In addition to the significant costs involved, what we need to do is make the program work and create an incentive for owners to engage in the program, not force them to engage in a program that does not work.
Mr. Chair and members, Pat Moran with Aaron Reed and Associates representing the San Diego County Apartment Association, opposed to the bill.
Thank you. Finance.
We don't have a position on the bill. We note that it could result in significant general fund costs for the Department of Fair Employment and Housing for additional enforcement. We're projecting an increase of about 175 claims and a funding request from that department for 1 to 2 additional positions totaling $200,000.
Thank you. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1137. Witnesses in support. Witnesses in opposition. Finance.
No file.
I'm sorry, 1134. 1134. It's Monday morning. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1460. Witnesses in support. Witnesses in opposition. Finance.
We don't have a position on this bill. The governor's budget proposes currently an additional $114.7 million in growth funding for the community colleges. This bill could create pressure, Prop 98 general fund cost pressures of up to $56.5 million within that new pot of money. But given recent enrollment trends in San Francisco City College District, it is unlikely that the district will reclaim that apportionment funding.
Got it. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Sir, did you want to testify, give testimony on a bill?
I just wanted to register support for 1134.
Okay, go ahead.
Chad Andrews on behalf of the California Civil Liberties Advocacy, in support.
Thank you.
Thank you.
That's support for 1137.
34.
1134. Members, the next item is SB 1167 by Senator Leyva. Witnesses in support.
Thank you, Mr. Chair. Members, Mitch Seaman with the California Labor Federation, proud to co-sponsor this bill along with the machinists and ILWU. We think it would make a world of difference for affected workers, and we urge your support at the appropriate time.
Thank you. Witnesses in opposition. Finance.
The Department of Industrial Relations estimates the bill would cost $456,000 from the Occupational Safety and Health Fund in one position to develop the standard. Generally, these are absorbable, but because of the bill's time frame and the complexity of the issue, we think that additional resources would be needed for the development and for enforcement.
Thank you. Questions or comments from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1215, Senator Allen. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Without objection, we move this item to the suspense file. Moving on to SB 1373, Senator Stone. Witnesses in support.
Good afternoon. Good morning. Kevin Aslan, Coalition California Welfare Rights Organizations. Currently, about 50% of the people participating in the Welfare to Work program do not get transportation supportive services. That's just like 50% of the people in your office do not submit travel claim. It's crazy. This bill would basically provide for a standard allowance. Anybody who is participating in a Welfare to Work activity would get a $100 travel expense voucher or money so they could pay for transportation. And I urge, hope to get it off of suspense. Thank you.
Thank you. Witnesses in opposition. Finance.
We don't have a fiscal estimate of this bill available at this time, but we do agree with the committee that it would be significant ongoing general fund costs to provide those amounts up front.
Thank you. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1389, Senator Glazer. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1417 by Senator Galgiani. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1439, Senator Block. Witnesses in support. Witnesses in opposition. Finance.
No file.
No file. Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Members, that concludes our agenda for today. We will adjourn. What item do you want to speak on? Sure. Why don't you come on? Of course.
You guys do you move quite briskly.
Yes.
Which is,
so that's SB 987 by Senator Aguilar. Go ahead.
do apologize. I am full of energy right now because if there was anything that I was passionate in life about, this would be it.
Go ahead.
I think that in the year 2016 and being some of the most intellectual minds that exist in the entire world, along with that should come compassion. And I think it's really important that, just like a couple gentlemen were speaking about at the time, that taking advantage of individuals who are sick, essentially individuals who are diagnosed with cancer, and telling them, you have cancer, you want to utilize this medication, we're going to take advantage of that and tax you to fix our sidewalks, or money for war, or even money for regulation. I think it's absolutely preposterous that we're going to take epileptic patients and Tourette patients and other patients that are suffering that actually should be receiving mercy opposed to continued sacrifice, a financial burden that could put either them out on the streets because rent has gotten so ridiculously high. And if you look at rent from 1974 and you look at minimum wage, there's a clear slant. And unfortunately, individuals don't have much money these days because of all the expenditures that they endure. And to actually apply a taxation towards medicine is unethical, it's deplorable, it's disgusting. It's not the United States in 2016. This is exactly why there's a following with Bernie and even Trump, unfortunately, because these types of politics, this status quo cannot stand. With prescription drugs killed 200,000 Americans every year, according to JAMA in 1998. The July issue in 1998 specified 200,000 deaths. That equates to 1 every 3 minutes, ladies and gentlemen. 1 every 3 minutes from prescription drugs. You won't hear the CDC talk about that. And it's very disturbing and suspicious, but it's 1 every 3 minutes. But again, the Journal of American Medical Association reported on that in the July issue in 1998, and we know that prescription drug use has skyrocketed since 1998. So obviously the numbers have increased significantly. Tobacco products is 450,000. Sugar, 300,000 deaths from sugar. Candy bars aren't taxed. Candy's not taxed. Chips aren't taxed. All those things that are causing diabetes and heart disease, all those things that are negatively impacting society, destroying our health, those aren't taxed. But we are going to attempt to tax a medication that is being utilized by a whole host of individuals with a whole host of different ailments. They're combating pain, ladies and gentlemen. They do not need to be hit in the pocketbook as well. That is not who we are, not as individuals. No matter what the occupation, we hold ethics first. Government is to exist to make sure that the common, decent individual is not harmed or exploited. This is a clear exploitation of patients, ladies and gentlemen, and it's our own government that wants to do it. This is outrageous. I do appreciate your time. I'm sorry for talking out of turn. I hope...
You're fine. You're fine. Thank you.
Thank you so much,
Actually,
y'all.
Senator Bell brought up some of those points that you brought up today, so we're going to continue to work on those issues. Thank you. Thank you for coming to the Appropriations Committee. Members, that concludes our hearing. Thank you.